Well, greetings again from Dr. Bill Wyatt with the American Orthodontic Society, and I want to discuss a case today. It's after correction surgically of the cleft palate, and then you can come back and redo the orthodontic work a lot of times after they've done the cleft palate work. Now, this young lady had cleft palate problem, as you'll obviously see, and we're going to come back and try to correct the teeth so that we cover it up, and maybe she could go back and the classic surgeon might could do a little bit more to help this situation. A lot of young men will grow a mustache up here. We've got one cleft palate operation we're showing here, and I'll show you kind of what we do in that situation. I scrubbed in on one of them. Let's go ahead and get back here and see this young lady, and you can see the cleft palate, the problem right there. Now, cleft palates mean if you're looking at the bone, they have to raise the lip up, of course, and the bone structure comes in like that. It comes in over here, and it doesn't join, and the periosteum in here is really tough. It doesn't stretch much, so they have to come in and they cut it down in here somewhere, and then they tie this together, and then they pull this down and they suture it together, and they fill the gap with bone structure. On the case that I screwed in, they got bone chips from the hip, and the guy told me his hip was sore than the palatal separation area that they closed up. But they'll close it, and now you can run the teeth back and forth in here. But when you got the periosteum there, you can't bring a tooth over it. So the palate has been done, and this has been probably when she was a bit younger, and we're going to come back and try to correct the teeth now after she's a little older. And this is a kind of a class 3 situation, and we wanted to move these teeth out, so we put a lip bumper in here to run interference for it and move this bone structure and the teeth. I don't think I have a picture of the lip bumper in this area, but we're going to bring these teeth out over the lower teeth, and it might bring the lower teeth in some. So we want to bring this area of the facial structure out just a little bit, and give also some length to it. She could stand to have a little more vertical length here. So let's see what we did. Now, in this particular case, this was where the separation was up in here, and she's missing a lateral tooth in this area. So we're going to try to center this little deformed tooth that she could have it crowned, and then make the space over on this side same as the space over here, and have her put a implant in that. And so you could put a bridge in it, either one. So let's see what we did. We're going to have to open this gap up here and move this to the center of the gap. Now, the teeth over here are in ideal class 1 relation over here, so we don't want to mess with that. Just leave that alone like it is, and you can see that. I'll erase it. Now let's go to the next view. The 4 anterior teeth here are just out, and she's in a class 3, so we're going to try to move those teeth over the lower teeth without making the mouth smaller, the tongue would push these out of the way if we could. So we're going to expand that and get that lined up in front. Then she could go have the crowns or the implants done. Now here we open the bite, and we had to put something in here to jump the bite over while we were doing that, and we added some. So when she closed her mouth together, these teeth fit down here. These upper teeth went down on the back side, somewhere like that. So we're going to have to jump that bite over, and what we'll do there, so we have this lined up in the bottom there. It just looks real good, but the upper teeth go down somewhere like here, and we want to correct that part. So we put some composite light cured acrylic here that's fairly soft, but it sticks on the teeth and stays and hardens, and they have to eat up here, and hopefully their jaw joint is in good shape. Otherwise you have to put something between the back teeth back here. But she can survive here while we move these front teeth. In other words, we're going to expand this whole area right here over that. Now the next view, I think we will go back the same way from the side, and we're going to try to center this little tooth in this gap and open this one and bring this together in the anterior part right here. Looking at it from the other side, so we've got a big gap in here as that tooth is coming up in contact there. Okay, we're looking straight on. We put an arch wire in here with to expand this. It'll have some spring-like thing on the back of the wire, bringing these teeth out, and then we're locating the teeth in the case. We're opening this up now, and it'll show that together, and also open this, and have these two spaces match one another. So here we've got the spring going. Now we're going to bring these teeth out, something like that, to go over the lower teeth. And we're pushing off the molars, so it kind of backs the molar up a little bit. And there's the deal of the block. And so here we are. This is started this case in 91, 7 of 91. And we got the teeth over. That's 10 of 91. We have it across, and the gap is opened up pretty good. So it's from 7 to 91, about 3 months. There we had the teeth over the hump. We took the block off. So here's started in 97, 24, 91, and this is 10, 5 of 91. So that's not a very long time. We brought these teeth out, and we're opening this gap, and we're building this space bigger too. So here it is 91, and we brought it out. We're trying to keep the back teeth like they were. And this is 91, and there it is, 10 of 91. We had the teeth over on the correct side. And there was, the teeth were in 91, and now they're out here. And I don't have the date on this, but it's a little further down the line, and we've lined that all up. We put a false tooth over here, but we need to get a bigger one, and we're going to have the space here and here, and put a crown on this deciduous tooth. Or this is not a deciduous tooth, this is a deformed permanent tooth. See, we'll use it in the treatment. So we'll put a bigger tooth in here, and then something, and she'll have to have that tooth crowned with something the same size. And we don't have any finish work periods after it's crowned and had the implant. But you see we've got the gap over here and over here, and we're going to put a false tooth in here, and then put a false tooth the same size over on that side of the mouth. And the rest of this is just like it was to start with. And now the bottom is, we just straighten it up. And so here she is later on after we finished, and I didn't get any finishing pictures of her, so you'll have to just kind of guess. And she could go back to the plastic surgeon. He could help this up here some. And again, this is all the pictures I have on this young lady. So I'm going to stop, and we'll say thank you for watching. Maybe you'll get some ideas about dealing with cleft palate patients. And I'll say goodbye and hope you'll join our group, subscribe to it. And I'm going to close out.